Cervical spine surgery. Produced by Blue Ridge Orthopedic and Spine Center. Anterior cervical discectomy and fusion is a surgical procedure that is performed to relieve pressure on a pinched nerve in the neck due to a herniated disc or spinal stenosis. To begin the procedure, the patient is placed under general anesthesia. A tube is placed to help the patient breathe during surgery. The skin over the surgical area is then prepped and sterilized with a cleaning solution such as chlorhexidine or an iodine solution. An incision is made in the left side of the neck at the level of nerve compression. The skin is then carefully spread and platysma muscle divided. The interval between the underlying muscles is then easily separated with the fingers, and a retractor is placed to protect the trachea and esophagus. The esophagus is the tube that carries food from the mouth to the stomach, and the trachea is the tube that carries air to the lungs. Once the muscles have been separated, the tissue is cleared off the front of the spine. In order to maintain good visualization of the surgical area, a self-retaining retractor is placed to hold the muscles, the trachea and esophagus, and carotid artery out of the way. Now that the disc has been exposed, instruments are used to remove the disc in its entirety. This allows the pressure to be taken off of the nerve. Two small posts are screwed into the vertebral bodies, and a device is placed over these to help separate the two bones apart. This allows better access to the back part of the disc and spinal cord and nerve roots. Once the disc has been removed and the pressure taken off the nerves, the space between the bones must be filled in. Sizing plugs are placed to determine the appropriate size of the spacer. There are several options for the spacer, including the patient's own bone, cadaver bone, or plastic or metal cages. Regardless of which device is used, they are all acting as a spacer and as a scaffolding for the body's own bone-making cells to grow through. Demonstrated here is a peak spacer that is packed with allograft or cadaver bone. The graft is impacted into place, thus separating the bones with a nice snug fit. The distraction device is removed. Next, the pins are carefully removed. This diagram demonstrates a plate and screws that is placed over the bone and spacer in order to hold the graft in place and provide additional stability. The plate is placed into the wound and aligned over the vertebral bodies. Screws are placed through the plate and into the bone to secure the plate. The alignment is checked with X-ray imaging to ensure that the grafts are in proper position and that the plate and screws are as well. The retractors are removed and the muscles allowed to come back together. The muscle layer is then sewn back together. The skin is closed with dissolvable sutures beneath the skin. A drain is then placed beneath the skin and a bandage applied over the incision. For more information, please visit our website at www.broava.com.